This segment is brought to you by the Dr. Carrasco Pain Cream. Don't leave home without it. Welcome to the show. I'm Dr. Carrasco. We're going to have a lot of fun today. We're going to learn about something medical, something that may impact you, may impact your family. It's always important to learn the information because you never know when you're going to need it. But first of all, let's meet our guest today.
My name is David. I am from San Antonio, Texas. I'm an x-ray tech, and for hobbies, I play pool.
Hi, my name's Lucy, and I'm a mother of 3.
My name's Andrew Infante, and I'm from Portersville, Texas, graduate of A&M, and I'm happy to be here.
Welcome. Welcome. Y'all know a lot about medicine? A little bit?
Yeah.
All right, good. We'll find out who knows the most and who knows more. But we also have a lifeline for you in case you need it. Guillermo Cintron. All right, so let's get started. We're going to ask you some questions, and we're going to see how much you know about medicine. All right, the first question. The lumbar spine on the adult human skeleton is located where? Is it A, in the neck, B, in the mid-back, or C, in the lower back? The lumbar spine on the adult human skeleton is located where? A, in the neck, B, in the mid-back, or C, in the lower back? Give me your answers, please. David, why do you think it's the lower back?
I just put the two L's together, lumbar and lower, so I just went with that.
Okay, thank God they started with the same letter. All right, Lucy, tell me, your name started with Lucy, maybe 3 L's. Go ahead.
Yes, I had to go for the L.
Gilbert, what do you think?
Well, I tell you, I mean, they were right on it. I mean, it's just basic anatomy.
Good.
The lower back is going to be the lumbar region.
Well, everybody seems to agree. Let's see what the answer is. See, the lower back. So let's talk about it a little bit. The lumbar part of the spine, the lower back, is where it's right here. There's 5 of these vertebral bodies. The thoracic is here. There's 12 of these bones, and then the cervical is up in this area. So we're talking a condition today called sciatica, and primarily affects the lower part of the spine. All right, well, let's go to the next question. Sciatica usually causes pain to which area? Is it A, the lower back, B, the low back in the front of the leg, or C, the low back in the back of the leg? Sciatica usually causes pain to which area? A, the low back, B, the low back in the front of the leg, or C, the low back in the back of the leg? Give me your answers, please. All right, well, David, why do you think it's C?
Because I have that issue on my left leg, and it's always my back and my lower leg.
Lucy?
I actually had that issue during my first pregnancy.
Sciatica. Oh, good. Did it go away?
It did.
How long did it take?
After the baby was born, it was completely gone. Yeah.
And that's a tough situation because when you're pregnant, we really can't do much to treat you other than, heat, massage, and gentle type stuff. Andrew?
I've been lucky enough not to experience sciatica pain, but the sciatic nerve does run through the legs.
All right, well, the answer is C, the lower back. Right, so let's talk about it. This nerve, that nerve, and there. All those 3 become 2 nerves, and those 2 nerves go on down to the bottom of the area. If you have a disc in here that's bulging out, pushing on the nerve, it'll cause an inflammation, as we see here, and cause pain all the way down the back of that leg. All right, that's sciatica for you. All right, let's go to the next question. Sciatica usually causes pain with which activity? A, laying flat, B, standing, or C, walking? We'll be right back. This segment is brought to you by the Dr. Carrasco Pain Cream. Don't leave home without it.
I've had low back pain for 4 years now. When I use Dr. Carrasco's cream at work, I'm more functionable because I sit all day. I get up and I roll it on just right there, and it really helps.
My daughter likes to use Dr. Carrasco's pain cream when she plays volleyball. Really helps her range of motion when she goes to perform. All my family uses it.
I'm using it all down my leg. I'm using it on my back. I didn't think that it was going to help me the way that it has, but it has actually given me a lot of relief. You don't have to keep reapplying and reapplying. That's how good it is.
I bought it for Judy when she has some spasms. She sleeps a lot better. It really works, and it helps her out, and it also helps me out.
I love Dr. Carrasco's pain cream.
Dr. Carrasco's pain cream helped me sleep all night.
Because it does work.
The Dr. Carrasco Pain Cream. Buy it today. Call 210-614-4825 or order online at carrascopaininstitute.com. Welcome back to the show. I'm Dr. Carrasco. So far, they've done great. Everybody's 100%. Here we go to the next question. Sciatica usually causes pain with which activity? A, lying flat, B, standing, or C, walking? Sciatica, it usually causes pain with which activity? A, lying flat, B, standing, and C, walking. So all right, give me your answers, guys. All right, well, we're all over the place. David, why do you think it's B?
My actually hurts all three of them, but I think B is the main one that really bothers me.
When it's really flared up, it hurts you when you're standing?
Standing, yeah.
Okay, all right. How about you?
For me, it was during my pregnancy, it was A, B, and C, but mostly laying flat, and that could have been because of the pregnancy. I wasn't too sure there.
Guillermo, you need some help?
They're pretty much all over the place. I remember reading an article just recently in one of our med magazines. The consensus was when patients with sciatica, they usually have pain when they have pressure, such as when they're sitting or when they're lying flat. So I have to go, I think Lucy is hitting it right on the head.
Laying flat. All right, well, let's talk about the answer. The answer is A, laying flat. Let's talk about it. Let's sit up here again. Lay down here for a second. When you have sciatica, the nerve is being stretched, okay? Anytime you're laying flat, it tends to cause more pain. People can't even lay down because there's so much pain. So if we elevate the leg, it stretches that nerve and causes more pain. We call it a straight leg raise. So when you see your doctor, he may elevate the leg and see if it causes pain down the leg. If it is, it's a very common sign for sciatica. Most people cannot lay down. But you're right, David, it can cause pain when you stand, when you sit, and when it's horrible, everything hurts. It doesn't matter what you're doing. All right? So let's go to the next question. Now, we talk about making a diagnosis for this condition. Radiologic diagnosis is best made with an X-ray, CT scan, or an MRI. When you're going to make a diagnosis, which study works best? Is it an X-ray, B, a CT scan, or C, an MRI? Give me your answers, please. All right, everybody says MRI. The answer is C, MRI. MRI, very good. All right, so here's the difference. An X-ray is going to tell you a lot about what's going on here with the bones. You see mostly bones here. The CAT scan will show bones well, a little bit of the structure, a little bit of soft tissue you see here. But the MRI, it'll actually show you the nerve. This is the spinal cord here. It'll show you the disc, the water inside the middle of the disc, all the way down. So you want an MRI to specifically see what the disc is doing if it's putting pressure on the nerves. All right, let's go to the next question. Surgery is most commonly recommended for which of the following disc changes on an MRI? So we saw an MRI. Now the question, if your doctor gets an MRI, which of those changes possibly lead to surgery? A, a normal disc, B, a bulging disc, or C, a herniated disc? All right, give me your answer, please. All right, well, everybody says C. David, why do you say C?
Well, I think a bulging disc, it could be treated with physical therapy, and well, also with herniated, but I think herniated is more serious condition.
Lucy?
I think B and C are very familiar, but from just past experience, I think C, herniated, is a little bit more severe.
Right, now you worked at a pain clinic, right?
I do.
So do you see more herniated disc or bulging disc?
more with the herniated disc.
Okay, good. Andrew, you went to A&M. You should know study this stuff.
I picked herniated disc. Bulging disc is not as severe as herniated. With the herniated disc, you do have some of the, you have more damage to the intervertebral disc.
The answer is C, herniated disc, herniated disc. All right, let's talk about it. This is your back if you're looking at it. The nerves come out of both sides, and the spinal cord goes right down the middle as you see here. A bulging disc means it's sticking out a little bit here. A herniated disc means it's come all the way out. So in this picture here, this is more of a bulge to some extent as you see here. A herniated disc, which is here, means it's come out of here and it's outside here, probably pushing on the nerves. All right, so that's the difference. That's why surgery is many times indicated in these cases. Coming up next, we're going to have something a lot of fun called the charades. We got an expert here. We're going to have a lot of fun. We'll be right back.
This segment is brought to you by the Dr. Carrasco Pain Cream. Don't leave home without it.
I play League of Legends. I'm a competitive gamer, and I have a lot of pain in my forearms and fingers because we practice every day. I love Dr. Carrasco's Pain Cream because it helps me so much when I'm playing games. My fingers hurt mainly because I'm always clicking either buttons or the mouse. It's always sore, and I just apply it immediately and I get immediate relief.
I put on Dr. Carrasco's Pain Cream before and after I play, or sometimes in the middle of games.
I use the pain cream every day. I really need it. If I didn't have it, I wouldn't be able to play at the level that I do.
I would definitely recommend Dr. Carrasco's Pain Cream to all of my gamer friends.
I've gotten a lot more than one. I love it so much. I just keep on using it, and I have to keep purchasing it and keep getting more of it just because we all need it, and my family needs it, my friends need it. I pretty much rely on it, really. It's just an amazing product. We all need it.
The Dr. Carrasco Pain Cream. Buy it today. Call 210-614-4825 or order online at carrascopaininstitute.com.
So welcome back. We're having a lot of fun today. Now we're doing something called the Medical Charades. We got 4 items, 1 minute. Guillermo's going to give you those items. Hope you get them all right. Ready, Guillermo? All right, come on back. Let's go. Please say anything out loud, whatever you're thinking, because you may be right. Ready? Go.
Nerve.
Sciatic nerve.
Pain. Oh.
Sciatica.
nerve.
All right, so Lucy. All right.
2 words.
2 words. The epidural injection.
Got it. Okay, good, good. Come on, guys. Talk out loud. You got to come on.
Can I buy a vowel?
A circle.
MRI scan.
Okay, come on.
I've had too many.
I'm
You're
not going to
in.
guess that one. It's not ladylike.
Man.
Incontinence? Okay. 2
Urine.
words. Urine incontinence?
There you go. All right, good job, Guillermo.
That was
Good
good.
job. That was pretty good.
I thought the MRI was going to be tough.
All right, well, let me see. Let's talk about him a little bit. The MRI, what were you doing with
Well, if anyone's done an MRI, you know, you're in this nice long capsule and that they'll put those earplugs and you just hear that clicking sound. Click, click, click.
So,
Yeah, something very
all
similar.
right, good.
Glad that he actually picked that up.
One
pretty
last
nicely.
one here. Urine incontinence.
Well, that one, unfortunately, you know, with all respect for the ladies present, you know, just trying to, you know,
Water the
hose.
You know, kind of yellow snow.
We're in Texas.
So urine incontinence is what you're trying to say.
Correct.
All right, what does that mean? You hold the urine or you let it go?
It, actually, they're holding it in.
Involuntarily holding it in.
If you're watering something, you need some kind of liquid, Guillermo. All right, have a seat. All right.
Well, that's what I'm.
Yeah, good luck with that. I think you just ruined your whole integrity there, guy. But let's talk about what's important here. Remember the MRI, it's better than the other studies to tell you what's happening with the disc and whether or not you may be a candidate for surgery. Sciatica, pain in the lower back, going down the back of the leg. It's important. It's going down the back of the leg and starts in the lower back, okay? Epidural injection, we'll talk about that soon, but an injection of steroids in the lower part of the back may decrease the inflammation that's occurring in the nerves and may decrease your pain. So an epidural injection is something you may have to go if you have this kind of condition. And finally, urinary incontinence. Urinary incontinence means that you have a difficulty holding your urine. That's a medical emergency. If you have sciatica or you have back pain and you have a difficulty holding your urine or holding your bowels, it's a medical emergency. Go to the doctor immediately. You may have to have surgery. All right, very good. Let's go to the very next question. Sciatica is treated with which of the following medications that requires the triplicate script? Ibuprofen, B, Flexeril, or C, hydrocodone. Sciatica is treated with which of the following medications that requires the triplicate script? A, ibuprofen, B, Flexeril, and C, hydrocodone. Give me your answers, please. All right. David, you say C. Why you say C?
Man, I already know what the triplicate script is, but
Then how'd you come up with the answer?
I affiliate words with the trip and hydrocodone because I know when people take it, they're out there. They're tripping. So.
Good luck on that exam. All right. The answer is C, hydrocodone. C, hydrocodone. So what's the difference? When you go to the doctor, you may get different kind of prescriptions. On the left here, you see one that is a regular prescription. You write your name, you sign it, and the patient takes it to the pharmacy and fills it. This is a triplicate, regulated by the state. This prescription has to be signed. It can only be signed within 7 days. It's for controlled drugs, okay? It used to be that hydrocodone, also known as Norco, also known as some other things, was a class 3 drug. But now it's in the same class as morphine, highly addictive. So anything that's addictive or has a high abuse potential will be moved up to a higher category. In this case, hydrocodone, you have to have this. What's important, though, is that if you have a triplicate prescription, then you have to pick it up yourself. You can't send your friend or your family member to pick it up. You have to pick it up. Let's go to the next question. Epidural steroid injections are best performed with the patient lying on their A, their back, B, on their side, or C, their abdomen. We'll be right back.
This segment is brought to you by the Dr. Carrasco Pain Cream. Don't leave home without it.
I have lower back pain. I do have pain when I get up in the morning, and after I take my shower, before I get dressed, I just apply the pain cream, and it's kind of, you know, you just forget about it after that. I get dressed, I go, and it helps me throughout the day.
And he stands straight as he can all day. He doesn't even use his cane anymore. So I'm pleased that the Dr. Carrasco pain cream that he uses daily helps that much. He needs to get another one today. He doesn't want to be without it, and I'm very grateful for that. He's just much better off all the way around. His stamina is unbelievable.
It has a very, very light kind of aroma. I was a little skeptical at first. I finally bought some, and I'm using it regularly now, and it really helps me.
The Dr. Carrasco Pain Cream. Buy it today. Call 210-614-4825 or order online at carrascopaininstitute.com.
Welcome back to the show. I'm Dr. Carrasco. Let's go to the next question. Epidural steroid injections are best performed with the patient lying on their A, their back, B, on their side, or C, their abdomen. Epidural steroid injections are best performed with the patient lying on their A, their back, B, their side, or C, their abdomen. There's many ways of doing them, but the most common ways of doing them is which way? Give me your answers, please. David, you say C. Tell me why you think C. You work in the operating room?
Yes, I do X-rays for most prestigious doctor in San Antonio.
That would be me. That would be me. Thank you very much, David.
And epidural injections, most of the time it's when laying on their stomach to kind of open up the vertebrae, and so doctor could go in and put the needle in the right place.
Lucy, what do you think?
I work in the field. I work in a pain clinic, and they're all in your back. They have to go into the epidural space.
But if they're laying on their back or they're laying...
Oh, on their stomach. Did I click?
Okay, it's all right. Don't change it. Guillermo's going to give you an opinion. You can change your mind with Guillermo if you want to. Guillermo, tell us.
We see this quite a bit, especially from past shows. And normally when we do the epidural injection, you'll see the patient lying on their abdomen or C.
Anybody want to change their mind? Go with Guillermo. You want to change your mind? Go ahead and change it if you want. Guillermo, let's see what they say. The answer is C, abdomen. Abdomen. The answer is C, abdomen. All right, so let's talk about it. This is the actual procedure performed in the operating room. The patient is on their belly or prone position. We place the needle in the epidural space and inject the medication. We're also using X-ray to help us confirm the needle placement with someone like David, who's an X-ray tech, helping us. Now, Lucy, you may remember when you have a baby, you may sit you down and lean you forward or lay you on your side. But for this procedure, we lay you on your belly. So let's go to the next question. This is a collar, a cervical collar. I put it right around my neck here like this when I'm doing procedures, just like that. A lead cervical collar protects the thyroid gland from radiation. Is that fact or is that fiction? A lead cervical collar. What do you think? Is it protecting the thyroid gland? Give me your answers. All right, everybody says fact. Well, the answer is fact. The answer is fact. All right, so let's talk about it. The thyroid gland sits right here, right in this area. And radiation can cause it to develop into cancer or some changes in the actual gland itself. So we use a thyroid collar. You see here, the nurse uses one. The people in the operating room will use a lead collar to try to protect that thyroid gland. Additionally, we're using lead here to protect our reproductive organs from the X-ray. Next question. Local anesthetics injected in the epidural injection can cause weakness. Is that fact or fiction? Local anesthetics injected into the epidural injection can cause weakness. Give me your answers, please. David, what do you think? I mean, these patients walk out, right?
They do, but there's some cases I hear that they sometimes feel weakness. I don't know if it's because of the anesthetic or because of the injection. They feel weakness in one of their lower extremities.
Or their legs. They may feel weakness in their legs. Right? So, Lucy, tell me, why do you think it's fact?
I had an epidural with my 3 pregnancies, actually, and that was one of my side effects.
Guillermo? What do you think?
Well, you see this quite a bit in the clinic after procedure. That's why we will observe the patient after the procedure. We will still, just for safety, of course, roll them out in a wheelchair to the vehicle, but we also want to make sure that they're able to stand before they exit the facility.
Well, the answer is fact. The answer is fact. All right, so let's talk about it. Here's a nurse helping a patient who had a procedure. What's important is that, it's kind of a difficult question because when we do an injection for an epidural, for low back, for example, we don't want you to be weak. We want you to be a little bit numb in the area. Really, the steroids do the majority of the work. But when you're having a baby, we want you to be weak. So we give you a stronger amount of medication. For an epidural injection, if you're having an epidural and your legs are weak after the procedure, it may have gone too far and got into the spinal fluid itself. Next question. Physicians recommend injections for lower back pain be performed every how many weeks? A, 2 weeks, B, 3 weeks, or C, 6 weeks. We'll be right back.
This segment is brought to you by the Dr. Carrasco Pain Cream. Don't leave home without it.
If I sit in the recliner and I'm watching TV, I have to be careful how I put my arm. I can't put it on top of anything because the pain gets worse. Just a very sharp pain coming from here down. You could feel that pressure going like that.
Kind of pulsating?
Right there in my arm, yeah. Then I got the cream and I rubbed it on there. I rubbed the Carrasco Pain Cream
to ease the pain. In the evening before I go to bed, that's when I put the cream on. It helps because I sleep good. Right now, the cream is working. I don't feel very much pain on it. I drive, I cook, I do laundry, I iron, I water the plants with the hose. I do everything, you know. I recommend Dr. Carrasco's pain cream to anybody that has pain. It works. It really works.
The Dr. Carrasco Pain Cream. Buy it today. Call 210-614-4825 or order online at carrascopaininstitute.com.
Welcome back to the show. I'm Dr. Carrasco. Let's go to the next question. Physicians recommend injections for lower back pain be performed every how many weeks? A, 2 weeks, B, 3 weeks, or C, 6 weeks? Physicians recommend epidural injections for lower back pain be performed every how many weeks? A, 2 weeks, B, 3 weeks, C, 6 weeks. Guillermo, we're going to give this to you first because I know they're going to need some help on this one.
Well, you see it quite often once again in the clinic, you being a specialist in pain management. When you, of course, schedule your patients for that second or third procedure, they're always 2 weeks apart. So I would have to go with A.
Guys, you want to go with Guillermo or you want to go on your own? All right, go ahead. Give your answer, please. All right, A. All right, tell me why you think it's A, Dave.
Well,
Other than Guillermo, the great Guillermo.
I usually don't go with other people's answers, Guillermo. So I think it's usually about 2 weeks, every 2 weeks. I think the steroid stays in the body for about 10 days. So the second injection will be about 2 weeks after.
All right, very good. Hey, that's pretty good. That's a lot of good information, David. All right, well, the answer is A, 2 weeks, 2 weeks. All right, here's a patient having an epidural injection. What's important is that most of the time for the medicine to build that when you have an epidural steroid injection, the important thing is the steroids. When you have it done, you see an effect, onset of about 3 to 4 days. It'll peak in about 10 days. You feel pretty good for 10 days. Then it starts wearing off. When it starts wearing off, the pain starts coming back, so we do another injection. Some people have 2. Some people require all 3. Everybody's different. Remember, we want to treat you just with what you need. If you don't need 3 injections, don't have 3. But if you need them, get them done. Let's go to the next question. The number of epidural steroid injections given in a year are determined by the dose of the steroids. The number of epidural steroid injections given in a year are determined by the dose of steroids. Is that fact or fiction? Give me your answers, please. David, we're going to start with you as always. You say it's fiction.
I say it's fiction. I think most of the epidural injections are pretty much the same dosage. I think it's more of insurance purposes. I think it's only allowed 3 times a year.
Okay, all right. The great Guillermo.
I'd have to go with fiction. It's not, I would consider more, I remember reading about...
Where? Where did you read this
I
at?
believe I want to say the New England Journal of Medicine.
Oh,
where they were talking about as far as when to take the steroids. And it's not basically regulated by the dosage as it is more by way of the regulation of insurance and so forth. So I have to agree with David.
All right, anybody want to change your mind now? You got David, you got Guillermo the Great. Oh, you're going to go to fiction? All right, you're changing your mind. Okay. Okay. Lucy, you going to stay on your own?
I'm going to stay on my own.
All right, good. All right, the answer is fact. Okay. Well, what's important is this is a patient having an epidural injection. And by the way, if you want to know, that's David kind of hiding back there. But what's important is it is the dose of the steroids that's important, because if you give someone too much steroids, their body doesn't make the steroids on its own like it did before. So be careful. Always add the amount of steroids that you get, not just from an injection, but from a knee or an elbow or a hip or anywhere else to get a steroid injection. All right? Very good. Thank you, everybody. Guillermo, what do you think? Did a good job today?
I think he did a really good job. I think all of us here learned some valuable information today.
Yeah, remember from Guillermo, if you have a chance, read the New England Journal of Medicine, but make sure you read all of it because he kind of missed that last question. Well, thank you very much for being here today. Thank you for watching the show. I hope you learned something. It's a different format. I hope it's a good way to learn and kind of be engaged with the show. But remember that pain is a difficult situation. If you have pain or discomfort, please talk to your doctor. Please seek medical help. Don't let it ruin your life or your family's life. I'm Dr. Carrasco. I wish you a life full of health, hope, and healing. God bless you, and I'll see you next time.
This has been a Carrasco Media Group production. Thank you for watching. For more information and videos regarding painful conditions, visit our website at CarrascoPainInstitute.com and drcarrascoshow.com. And I invite you to like, subscribe, and leave your comments.